Hello, everyone, and welcome back to Healthy Talk, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today we're talking all about diabetes, how to understand it, manage it, and support the people we love who are living with it. Joining us today is someone new to Boone County Hospital, but not new to helping people take charge of their health. Jessica Van Dalen, a registered dietitian and diabetes educator. She's already making a difference with patients here at Boone County Hospital, and we are excited to have her. Jessica, welcome to the show.
Thank you. I'm excited to be here.
So you're new to Boone County Hospital, but not necessarily to this field. Could you tell us a little bit about your background and what brought you into dietetics and diabetes education?
I knew I always wanted to go to Iowa State University.
Sure.
It's where my aunt went to college, and I've always looked up to her. So I chose my major after I chose my college.
That's fine.
I literally sat in my living room the one night. I was just scrolling through the options. I was like, what could be fun? And I was trying to decide between food science or dietetics. I was like, sure, let's do dietetics. That sounds fun. Literally had no idea what it was. Didn't know what I was getting myself into. And I quickly found out that it's a much more complex field than what I could have ever imagined, but I honestly wouldn't change it for the world. It's been great actually learning about it and diving into it. It was definitely a huge adjustment for me,
Sure.
But it's been fun.
What does your role here at Boone County Hospital look like day to day?
My day-to-day varies quite a bit. I'll see anywhere from 1 to 5 patients a day, depending on what they're needing. We'll go over their data with their meters, their medication regimen, lifestyle, anything along those lines. And then we start working on building a plan that works best for them. Sometimes if someone's admitted into the hospital and they just need help with whatever it may be, I might go down there, pop in whenever I have time. I am a registered dietitian, but I don't have my CDCES, which is commonly needed for diabetes educators. You don't have to have it, but it's just kind of that extra level of education. So right now, if I don't have a lot of patients on my schedule, I'll just be sitting down doing coursework, studying, reading different research studies, just trying to get into it as much as I can so I can hopefully take my exam next year at some point. Awesome. And then get that credential. And then right now, we're really just trying to kind of build up the program and make sure it's a really good quality program. So lots of meetings here and there. Sure. So it's really just kind of a hodgepodge every single day. I really never know what each day is going to hold until I'm here.
Do you like that?
I do love that. It's great.
What would you say you find most rewarding about your work?
I think it's really just trying to help people understand that diabetes doesn't have to rule their life. It's a very progressive and complex disease, and there's a lot of stigma surrounding it. I want to be that person to just kind of help remove that stigma first from the individual who has diabetes, but also for the public too, because I feel like the stigma is part of what just adds to the pressure of living day to day with it, and it just makes it more unbearable for some people. So if we can remove that piece from it, I find that it just makes it so much easier, and just really breaking it down to bite-sized chunks so that they can be successful at managing it.
I would imagine you probably get a lot of people who are pretty anxious when they're meeting with you.
For sure, especially if they're newly diagnosed and if they don't really know much about it. You know, you see so much in the media and online about diabetes and the complications with it and everything that you need to do to be healthy. And I feel like a lot of it comes from a good place, but it's just the way that the message comes across just adds to the fuel versus actually helping people.
100%. Well, let's break it down for some people. What's the difference between type 1 and type 2 diabetes?
Type 1 and type 2 are pretty similar, but the big difference between the two is that type 1 is an autoimmune disease. So it's pretty much where the body starts attacking the beta cells, and beta cells' sole purpose is to produce insulin in our body. Over time, that insulin production will start to decline, and then that blood sugar management is more ineffective than what it once used to be because you're just not producing as much insulin. Type 1 is usually diagnosed far earlier in life than type 2. It's usually kids, teens, and young adults, but really anyone at any stage of life can be diagnosed with type 1. It is commonly genetic, and that's just because it is an autoimmune disease, but it can also be caused for other things too. So it could be caused by a virus, an environmental trigger, or having another autoimmune condition. Our bodies do really weird things, so it could just be something that causes the switch to flip, and then there you go, you have another autoimmune disease. Whereas type 2, it is also very commonly genetic, but there's so many other factors into it, so many more influences that can cause someone to develop it. Genetics do play a huge role. If you have one parent with type 2 diabetes, you have a 50% chance of developing it at some point in your life. If both parents have type 2, then you have a 75% chance of developing it. The different causes for type 2 can really be anything from ethnicity, PCOS, certain medications, and any underlying conditions that increase your insulin resistance. Insulin resistance is kind of the start of type 2, and then it just progresses as time goes on. So as that insulin resistance increases, your body has to produce more insulin to regulate your blood sugar, and that just puts more stress on your body, so your beta cells start to die off, which can make insulin resistance worse, and then just blood sugar management worse. And so then it's just kind of a continuation of it all until you fall into that scope of having type 2. The one thing that is really big that I try to remind people of is sometimes they have to go on insulin with type 2, usually type 1, and there's a lot of stigma around insulin especially, but I want people to think of it like a supplement. You're just supplementing your body with something that it's not producing anymore. By supplementing with insulin, you're taking the load off of your body, and you're able to protect the remaining beta cells that you do have because they're not having to work as hard. Usually going on insulin isn't necessarily a bad thing because you're kind of helping your body with something that it's struggling to do in of itself.
What are some signs someone might have diabetes and not even know it?
So a lot of common signs would just be excessive thirst and urination, increased hunger, unexplained weight loss, blurred vision if you get a cut and it takes forever to heal or it gets infected, and then other frequent infections. A lot of those are just common signs. Some people might have diabetes for a while too, or even prediabetes, and they won't know it either. So sometimes people go a very long time without being diagnosed, and that's the worst part because you don't experience any difference. So a lot of times there can be symptoms and sometimes there might not be anything at all.
What kind of testing is used to diagnose diabetes?
Diabetes can be diagnosed a few different ways. Usually it's just through a simple blood draw. You can do a blood draw, or for gestational, we do the oral glucose tolerance test. Typically for the blood draws, we look at your A1C and a fasting blood glucose. Anytime someone has an A1C over 6.5%, or a fasting blood glucose over 127, that will indicate having diabetes. Now, to differentiate between whether you have type 2 or type 1, we will also check for antibodies. So if you test positive for those antibodies, that indicates that you have type 1. For gestational, we do the oral glucose tolerance test. There's different doses, I guess you could say, for the oral glucose tolerance test, and then different parameters around it. But the most common one is just the 50 grams of glucose, and then you get your blood checked in an hour. And if it's under 140, then you're in the clear. And then we also have the 3-hour one, which is usually 75 grams of glucose, and then different measures for each hour that they're looking at that.
Are there any risk factors for type 2 that might surprise people?
Family history is a big one, but if you're diagnosed with heart disease, kidney disease, gestational diabetes, PCOS, liver disease, or sometimes even age or physical inactivity can lead to the development of it. Like I said earlier, our bodies can do some really weird things. So sometimes you just sort of hit an age and then your body just decides to not work like it once used to.
Sure. What are some myths that you hear?
The two biggest things that I'm always seeing is that diabetes is directly caused by being overweight or what you eat, when it is so much more complex than that.
If only it was that simple, right?
Exactly. Then everyone would be good and no one would have diabetes if that were the case. Someone could eat pizza for every meal every single day of their life and they won't have diabetes.
Sure.
But someone could have the most perfect diet, exercise all the time, and they still might develop diabetes. So it's really sometimes not anything that you can control. Yes, sometimes changing what you eat and adding in physical activity can reduce your risk, but it's not foolproof either. Another common myth a lot of times is, once you're diagnosed, you can't have any sweets or carbs, which it's the opposite. I actually promote you to have carbs in your diet. Carbs are our body's preferred fuel source, and if we're not getting enough carbs, carbs, then we're hurting other functions of our body. And it can actually make the management of diabetes even more difficult.
Okay.
So people will start cutting out all carbs and sweets the minute they're diagnosed, which that's just going to add to the stress. And that in of itself can make your blood sugar worse. So please eat your carbs, but it's just how we eat them that's really going to influence how our blood sugar is managed.
What's something people might not realize about how diabetes affects daily life?
Living with diabetes can really change the perspective for a lot of people. So there's just so many more things that you have to keep an eye on, different aspects that you have to think about in your day-to-day. So not only is it, well, what foods can I eat now? What's my blood sugar doing? Your medications, adding all that stuff in, but also staying on top of other hygiene aspects. Dental, foot care, eyes, those are just 3 really big things that can be easily affected by our diabetes. If someone gets a cut on their foot, they really have to keep an eye on it because it can very easily become infected and necrotic and gangrene and not fun. Where someone without diabetes, they get a cut on their foot, it's no big deal. So it can really add to the weight of it all.
Is any diabetes, all the things that you just said to watch for and everything, not just type 2?
Yes, it's for type 1 as well. Gestational is a little bit different just because it's technically diabetes, but not really.
Sure.
So some of those things aren't as big of a concern when you have gestational, but you still are at a higher risk for those than someone who doesn't have it.
How are you able to personalize care for each of your patients?
I really try and meet each person where they are. I try and help them figure out what their non-negotiables are. If someone's coffee is the one thing that they will absolutely not change, like that's the one thing they look forward to in the morning. If it's a cream with 4 sugars, great, let's keep it. Let's try and figure out what other things we can do to better manage our blood sugar so that you can still have coffee in the morning. It's really just trying to help each person with what is going to work the best for them to make it easier for them. We don't have to make all these drastic changes or anything like that.
Let's shift to gestational diabetes.
Gestational diabetes is the inability to manage blood sugar in pregnancy. It's different from type 1 and type 2 in the sense that your blood sugar management can go back to normal after the baby has been delivered. Literally, it could be the minute baby is out, blood sugar is back to normal. Some people, it can take a little bit for their blood sugar to start regulating itself again, but a lot of that deregulation is just due to the hormonal changes, and we have a natural increase in insulin resistance that occurs with pregnancy. So as pregnancy progresses, that insulin resistance increases, and some people's bodies just can't keep up with the demand of insulin, and so that can just lead to the development of gestational diabetes. But then once you're no longer growing a human being, your body can manage that effectively again. Okay. It can be pregnancy by pregnancy, and a lot of it's really just the placenta, like what the hormones look like, all that fun stuff. Some people might have it for one pregnancy and not have it again, or they might have it again, and some people might go 3 pregnancies and not have it, and then all of a sudden they have it. Yeah.
I had gestational diabetes when I was pregnant with both my kids. When you're first pregnant, there's so many things, and you just assume everything's going to be fine. Mm-hmm. I mean, I'm pretty healthy, no history. I wasn't overweight, and I was like off the charts.
Oh, wow.
And when I failed, I was so embarrassed about it, very secretive of it. I didn't tell anybody that I had gestational diabetes. I would go out with friends, and I would I have to go to the bathroom to test myself. And then after, I was like, why was I so embarrassed about this? And so with my second, I figured I would get it again, and I did. But I was so much more open. I didn't care. I realized this is not my fault.
Yeah.
Honestly, it was a blessing in disguise because I ate a lot healthier. I worked out more. So like you said, with the stigma, there are things that you can do to help manage it, but it's not necessarily your fault. So what advice would you give to expecting mom getting ready for their glucose test and they're nervous, or fail their glucose test and now have found out that they have gestational diabetes?
Yeah, so my biggest piece of advice is leading up to it, just try your best to have balanced meals. physical activity as you're able. Those are the two things that can kind of really help your body adjust better to pregnancy. But there isn't really a foolproof way to prevent the diagnosis of gestational. Sometimes there's a lot in pregnancy that is just totally out of our control. So it's really just kind of reducing your stress. Stress can make it more difficult for you, and that can increase blood sugar just from the stress alone. Not saying that's going to lead to the diagnosis, but all these factors can have a play into it. So try not to stress about it, and just know a lot of it really is kind of out of our hands in pregnancy, and just trying to roll with it, taking it as it comes. Morning of, when I was pregnant and I was preparing for the gestational test, I knew I was probably going to feel super nauseous and sick afterwards because that's a lot of sugar. It enters your bloodstream super fast, and so a lot of times you're not going to feel the best after. It's so hard to prepare for it, but just try your best, and if you can, maybe take off the day of work afterwards if you have to go back to work.
After a baby's born, is it important to do follow-up?
Yeah, it is. Having gestational diabetes increases the mom's and baby's risk of developing it at some point in the future. A lot of it really depends on how well you manage it during pregnancy, and then what lifestyle changes you put into place afterwards. It really just kind of depends too on the person. If you have a strong family history of type 2 and you have gestational, it might not even necessarily be the gestational that increased your risk. It's just the family history there. So yes, gestational can increase your risk, but again, there's so many other factors too that can come into play with it. For the baby in the hospital, they will usually check their blood sugar for so many hours, days afterwards until they see the results that they like. And then it's just good to kind of just keep that in mind and have their A1C checked every so often as they're growing up. But for mom, I really like to have them come in and get a new A1C at 12 weeks postpartum. So your A1C will measure the last 3 months of your average daily blood glucose. So that will give me the first 3 months after pregnancy to just kind of see what has your body been doing, what does glucose look like. So that can kind of help me determine where is our risk value at. Are we in the pre-diabetes range where we really need to start working on some stuff now to kind of limit that risk or slow that progression? Or is your A1C really good and your risk is relatively low? So I really like to have them come in and get that A1C just to see where we're at with that. And then it's usually recommended to have that A1C checked every year after, just as like a follow-up and see, is your body still doing good? Usually 5 years after having gestational diabetes, the risk is basically back to normal. There is a chance of developing it again later on in life, but usually if you're going to develop diabetes after having gestational, it'll be within those first 5 years after having it.
Are there any additional risks, or what happens to the baby when someone has gestational diabetes?
When mom has gestational diabetes, the biggest risk factor for baby is glucose crosses the placenta, but insulin doesn't. So if mom's blood sugar is running consistently high, then that will make baby's blood sugar running high as well. So mom's insulin will be working in her body to lower her blood glucose, but it won't be affecting baby. So then baby has to make their own insulin to combat that. So that can just kind of make it more difficult for them to regulate their own blood sugar, because they're not very good at that yet.
Who can blame them?
Exactly, right? They're still learning. So that can just kind of lead to a lot of complications for them. So that can lead them to being a larger baby just because the glucose is just kind of leading to that. But then it can also just kind of lead to other complications too. So if the blood sugar is consistently running high, mom's body isn't doing a really good job of negating that, baby's not doing a really good job, it can, in worst case scenario, lead to stillbirth or death just due to lots of glucose circulating in the blood. The other thing I like to talk about is some women get so scared when they are diagnosed with gestational that they completely cut out carbs, but then their blood sugar is running low all the time, and that can then lead to development of ketones in your urine. We don't want that either, because then we know mom and baby are both stressed, and that can also lead to complications. So it's just trying to kind of find that good balance in the middle, which it can be very, very hard, especially because it changes week by week on what your insulin resistance looks like and your insulin needs look like, and even day to day. So like sometimes if you're sick or baby's going through a growth spurt, blood sugar can do some weird things.
Let's talk about prevention. What works when it comes to avoiding type 2 diabetes?
The best thing that we can do to work towards prevention is just kind of knowing where our body is at with managing blood glucose. Usually, if you have a strong family history of diabetes, I would get your A1C checked every single year if possible, as soon as possible.
Is that something you can do when you go for your annual physical?
Yeah, if you get your annual physical, most insurances will cover an A1C every 3 months, depending.
You can go down to the lab and do it too here, right?
Yeah, you can just go down to the lab. We're hoping at some point that I can get my own A1C machine so that we can start checking them when people come and visit me too. But checking your A1C, just kind of seeing how your body's doing with it, so then we kind of know. So many people have prediabetes and they don't know it. You can have prediabetes for 10 years and not know it, and then you all of a sudden have type 2 and people are like, well, this came out of nowhere. Yeah. It's like, well, your body's been struggling for a while. We just didn't know it. So just checking your A1C can really help. Getting that physical activity wherever and whenever you can. So increasing your NEAT movement, whether it's taking the stairs at work or parking the farthest parking spot away at the store, just trying to increase your movement as much as you can, especially after meals. That can take the load off of your body of having to produce that insulin to uptake that glucose. Your muscles are automatically doing it, so then your body doesn't have to worry about regulating it. So movement after meals can really help, but then just having balanced meals in of itself. Maybe not sitting down and having a whole large pizza for dinner every single night, and instead having like 2 or 3 slices and a salad on the side. That can really help too with managing blood sugar. Not saying that it's bad to have spikes in our blood sugar. It's normal, but it's also less work for our body, which can help preserve our body for a little bit longer.
Right. Let's talk about someone getting diagnosed. What's next for them?
The best thing would be start working on identifying what aspects of your life might be contributing to that greater imbalance in blood sugar. Whether it's medications that you're on, lifestyle factors, underlying conditions that we probably want to work on taking care of. Just figuring out what might be that potential cause to it. If it's genetics, then we'll just start formulating a plan, working on what's going to work for you to slow that progression of the disease.
What do you do to keep nutrition guidance realistic?
I will never tell someone that they can't eat anything. I don't believe in cutting out foods. Food is such a huge part of our lives. It's in almost everything that we do, whether it's you have a baseball game, it's a holiday.
We're always eating.
Exactly. So that's just going to create so much stress and pressure. No matter what you're doing or where you're going, you have to worry about what you're going to eat. It's just working on how we can eat our foods to better balance our blood sugar and prioritizing, like, okay, I know I have a birthday party tomorrow, but we're going to a baseball game tonight. So maybe tonight I'm going to bring some food to the ballpark, and then tomorrow I'm going to have that cake at the birthday party. So trying to prioritize what events are more important to you,
Sure.
when you might maybe not have as balanced of meals, so that it's not all the time or every meal, but that you're still living your life and having that enjoyment and quality to it.
How can family members be supportive with someone who is diagnosed with diabetes?
A lot of times I see when support people come with whoever is diagnosed with diabetes to the appointments, they come because they care, but how they go about it might not be the most beneficial for their person. They might be showing lots of tough love, like, no, you can't do this, you have to really stop that, or calling them out in appointments. I really like to try and kind of build that trust with whoever is diagnosed so that they feel comfortable telling me whatever it is, knowing that I'm not going to judge them for it. Releasing that judgment from stuff can really help increase that internalized motivation on the person diagnosed with diabetes. So just providing that support in the way that they need, asking them what they need, being there. If they're really struggling with managing their blood sugar, try and be curious about it. Try and figure out what is the one thing that's holding you back. Is it something mentally? Is it something physically? Trying to help them and figure it out, because sometimes they don't even know what it is, and they don't need someone who's supposed to be their support person kind of knocking them down too.
Should you be eating that?
Exactly. Exactly.
Who wants to hear that?
Yeah. A lot of people know what they need to do. And so just kind of having those constant reminders can just increase the stress and the pressure. And so then they start doing the opposite because it's just too much. And that's just an easy coping mechanism to just say, well, I'm going to ignore it all and just keep doing what I'm doing. So just trying to kind of help them and guide them and be curious about what's really going on.
How about a kid?
Yeah.
Is that hard?
The best thing that I encourage with kids is really trying to not focus on the diet aspect of things, regardless of the situation, if they have diabetes or not, just kids in general. Just trying to promote nutritious foods. Grazing tables are great for kids, just kind of letting them have a little bit of everything. And for kids in general, we really don't try and pressure what they're going to eat unless they have a really, really complicated case of diabetes. But that's kind of what medication is for at that point.
I was going to say, if they're diagnosed younger with type 1, it's got to be insulin controlled, right?
Yeah, exactly.
So then that helps you combat what you're eating, right? Using that medication.
Mm-hmm. It does, yeah. And a lot of times kids with type 1 struggle with gaining weight anyways.
Okay.
And so we don't want to pressure them with diet or food changes. First of all, their brains aren't developed enough to understand that. And that can just lead to burnout later on in life. That's why we see so many teens really struggling with managing their blood sugar because they have that fatigue with it.
Sure.
They're burnt out with it. So starting young and just trying to kind of keep that decision making away from them and taking that burden for them and slowly adding that in for them can really help not be burnt out by the time they reach adulthood.
What kind of services do you provide for diabetes at Boone County Hospital?
Right now, we have one-on-one appointments with me. We're hoping in the future to add either classes or awareness information or outreach programs or pieces to it, but it's going to take time to get there. I really want this program to be really high quality, and so we're just kind of taking it slow so that we can fix the bugs before we're too far ahead of ourselves.
Right. You don't want to get the ball rolling and not be able to stop it.
Exactly.
You need to change something. What would you say helps people stick with the lifestyle changes that they have to make?
I think the readiness to change is a huge factor. So if someone's not ready to make any changes or they're just really resistant to hearing anything, then we're not going to really get anywhere with managing blood sugar. But also, with that being said, we want to make realistic and sustainable changes. Some people are super motivated to change. It's kind of like a huge breakthrough to them, and then they go all in, but then they burn themselves out. And then they're kind of on that roller coaster where they're either all in or they're not.
Finding that balance.
Exactly. And that's almost worse for your body because it's those dramatic changes and it's a lot more stress on our body. So just taking slow steps and making realistic changes is just kind of the best way to go about it.
Let's talk about some tech. How have tools like continuous glucose monitors changed diabetes care?
CGMs are a great tool to be using. It really helps me see so much more data and see what's going on. A lot of times people who come in and they're using a blood glucose meter where they're just sticking their finger and checking maybe once or twice a day. It's not really giving me much insight on what's going on. Whereas if I can see 24/7 data, it really helps me kind of see where our problem areas are so that we can adjust medications or adjust food or exercise, whatever it may be. It's so much more insightful, and it's just making that management easier for people. I will say the one downside with the CGMs is if someone has a history of disordered eating, it can kind of fall into that scope really easily. You're seeing the almost instant effects of what food or exercise or stress or colds have on your blood sugar. And so then that can really just kind of fuel that disordered eating, and just the mental health side of things can be not so good for some people.
Before we close, I know you haven't been here that long, but in your career as dietitian, is there a story or a moment that sticks with you?
Yeah, this was actually at my job that I was at previously to this, but I had a client who has type 2 diabetes, and she was really stressed and overwhelmed when she was first diagnosed. So she was the type who she just cut out so many foods. She had a lot of food allergies on top of it. So It just made food so complicated and stressful for her.
I can't even imagine.
Yeah, she just came to me and it was just so disheartening to see how upset she was with everything. But we sat down, I kind of gave her some hard truths about it, and over time we worked on adding those foods back in, and her blood sugar actually got better. Her A1C got better, and I think a lot of it just had to do with she wasn't stressed anymore. She was able to enjoy her food. Quality of life improved. Her family was telling her that they've seen such a change in her, and they're excited because she started going out to eat with them again. So just kind of seeing her have that quality of life improved, it's just so rewarding for me, and that's what makes the world of difference. I don't want diabetes to be something that runs someone's life. It should really only just be seen as just something we need to just kind of keep an eye on, and just something that we add into our backpack. We're just taking it with us, but it's not going to be what drives us around.
What would you say to someone listening who's struggling with diabetes right now?
I will never know what it's like to live with diabetes in the day-to-day. I only know what I see from my patients or from friends or family who have it. But I will say the one thing that I want people to know is that diabetes does not define you as a person. You will never hear me say that person's a diabetic. It's a person who has diabetes. Diabetes does not define you. It's just a condition that you have, something that you're trying to manage and work through. So I think the way we talk about diabetes is a huge part of it, and hopefully society will kind of go along with that at some point, because I think that can kind of ease that pressure for a lot of people. But knowing that the disease does not define you as a person, and I am here for support. There's so many other people out there for support, and it doesn't have to be something that you have to work on your own.
If someone wants to come meet with you, can they call you directly? Do they need a doctor's referral? How does that work?
So we do need a referral just for insurance purposes. So the best way to kind of go about it is to either call your primary doctor, have them send me a referral, and I will call and get them on my schedule. Or if they really want, they can call me 515-433-8619, and I can reach out to their provider and get that referral as well.
Jessica, thank you so much for joining us and sharing your expertise with us today. If you'd like to learn more about diabetes education at Boone County Hospital, you can visit our website, www.boonehospital.com, or give Jessica a call, 515-433-8619. That's it for today's episode of Healthy Talk. Don't forget to subscribe and join us next time as we continue exploring health and wellness in our community. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.